A long time ago in a galaxy far, far away. Revision Wars. Episode 8. Public Health 1800 to 1914.
Oh dear, just look at the disgraceful mess we're having to live in. The houses, they're so tight together, there's so many of us. We've got a pig down here. I'm having to step over this human waste. The river that we live next to, look, it's just, my children are growing up in here. Why does nobody care about us? Oh no, laissez-faire there.
I'm laissez-faire. The reason you live in these conditions is because we're rich and you're poor, and well, that's your own fault. Why should the rich pay to help you, the poor? That's right, government. If you pay money to help the poor, your rates will go up. Who wants that?
Hello, I'm Edmund Chadwick, and this is my friend William Farr.
Will you help us?
Well, the year is 1842, and I've decided it's time to write a report on living conditions for the poor people.
Yay!
Let us investigate, shall we, William? My. What a disgusting state. Look at this miasma! People will be getting really ill from this. We all know that miasma is what causes disease. We need to do something about this, and quick. Right, I'm going to write a report. I'll be back shortly. Government, we have written a report. We feel that you must implement some changes and bring in the 1848 Public Health Act.
Yay!
Okay. I will implement the 1848 Public Health Act. But make it not compulsory so people don't have to do it.
Oh dear, it's a warm day in this fur walking around. I'm thirsty. I think Shaw's a pump on Broad Street. Let's go there. Oh, delicious. Oh, hang on, I'm not feeling too well.
We've come from another town to try this water from the Broad Street pump. My grandma says it's really nice. Oh, I don't know about you, but I'm not feeling too good. My stomach's really hurting. Oh gosh, I'm not feeling too good either. I'm really hot and sweaty with tummy pain.
I am Dr. John Snow. I'm going to take a walk around the Broad Street area in Soho, see what people are doing, see how the health is. Let's have a look. Oh dear. Oh no. What? There's been another cholera outbreak. I'm going to investigate further. Excuse me.
Hello there.
Can I ask, where do you get your water from?
Oh, over there at the Broad Street pump.
Oh. Has anyone in your family died of cholera?
Yes, my brother did.
This is tragic. I'm going to map out these findings. There's got to be a pattern here. Yes, it's definitely coming from the pump. We need to do something about this fast. I need to contact the government. Government?
Hello.
We need to do something about Broad Street pump. People are catching cholera from the water. I've proven that cholera is a waterborne disease. Look at my graph. No doubt at all. We need to take the handle off the pump and we need to sort out people's water supplies.
Don't listen to him, government. Don't listen. He's talking rubbish. Illness is still caused by miasma in the air.
Idiots. Well, I'm going to take the handle off this pump anyway, and that'll solve the problem in this area. Goodness knows what's going to happen to the rest of London, though. Well, at least the people of Broad Street are now safe until we can further investigate the causes of disease. I am Louis Pasteur. I've heard there's an issue around here to do with disease spreading. If only I could have told these people earlier about my germ theory. I could have saved thousands of lives, but definitely germs do cause disease. It'll be dirty water like this that's the problem. Something must be done.
Hello there, government. Can I have some money to build a sewer? I want to start cleaning up some of this mess that we have in our streets.
Oh, don't be so silly. No, we're not going to give you money for that. Well done, government. As a laissez-faire bear, it doesn't affect us, so why would we pay for it? Who cares about those poor people?
Oh my, what? Seriously, what is that smell? Oh, it's coming from the river. Oh God, I've got a mask on and I can smell that. That's absolutely vile. We're gonna have to, Parliament's gonna have to move. We can't sit next to this stink. It's a massive, massive, great stink.
Right, that's it. I can't work here anymore. We need to leave.
Hello, government again. Now can I have some money?
Of course you can. That great stink meant I had to leave the House of Parliament. I can't be putting up with that.
Hooray!
Something needs to be done.
Yes, so long, laissez-faire. At last, I can finally build my sewers. Easy does it. Easy does it. Come on. Hooray! We can now get rid of the waste. Hooray! Woo!
Okay, the Conservative government have decided to introduce the 1875 Public Health Act. This is going to be compulsory, so everyone in every town must abide by it.
But wait a minute. I'm David Lloyd-George. I represent the Liberals, and I don't think your reform's going far enough. We need to bring in more reforms. I'm certain of it. There must be some good reasons for spending serious public money on improving things. Oh, who's this?
I am from Germany, the Germans, and we have a really good public health system, which means that our workforce is really healthy. This meant that Germany had really high output and we earned more profit, even more than England. Haha!
Wow, that sounds like a really good idea. Though to be fair, I am Welsh, but still. What else? There must be other reasons for bringing in public health reform. Who's this?
Well, as working folk, we've suddenly got the vote now, and so we're trying to think about who to vote for. Well, you could vote for us. We're the Labour Party, and we will protect your interests and make your lives better.
Oh, hang on. I'm going to have to do something about this, or they're all going to vote Labour. We need more reforms. Something to think about. And who's this guy? Louis Pasteur. Yes, indeed, it's I, Louis Pasteur. You must know by now that there is a scientific reason to bring in public health reform. There's no need to blame my asthma anymore. I've proven it with my germ theory of 1861. You must act fast. He's right. Oh, hang on, who's this? Oh dear, he's a soldier. The British Army's looking in pretty poor shape, if I'm honest. I can see that fella's ribs. Oh, we're going to have to do something about this and fast. Who are these fine fellows?
Well, I'm Booth, and I am Roundtree, and we've created reports that show us how bad things were. I did one in London, and I did one in York. It's a problem nationally, and it's not just about poor people.
Something definitely needs to be done. I know, I'm going to introduce New Liberalism!
Hello, I am New Liberalism.
Hooray!
Woo!
New Liberalism. Let's introduce some reforms to help the poor. We will begin with free school meals. The Free School Meals Act of 1906. Now, children at school will get one hot meal a day, even if they can't afford one at home. Good news for you, Sonny Jim.
Yay! However, some of my friends don't get the free school meals. Why is that?
Well, unfortunately, we couldn't make it compulsory. It was too expensive. But at least 50,000 children are now getting a free school meal every day, so it's pretty decent. Who else can we help? I know. Let's help the old people.
Yay!
Hello, madam. We're going to introduce a pension. Pensions Act of 1908.
About time!
Now, the only issue with this might be, first of all, are you over 70?
Yes.
Ah, right, well then you will qualify for the pension, madam. Have you always worked?
Not really, no.
You see, this is an issue because I suppose you were looking after your family. The pension might not be suitable for women who haven't worked, or for people who haven't worked for other reasons, or been in prison, or been abroad, let's say. But other than that, we're going to introduce a pension for everybody over 70. I think this will make quite a big difference, despite what Granny Bear seems to say.
I benefit. Yay!
Yay! Finally, I know what new liberalism. We need to introduce something for the workers. Oh dear, look at this chap. What's happened to you? I've had an industrial accident, hence the bandage around my head. Well, good news. In the past, you would have got no money when you were off work and probably would have starved and been evicted from your house. However, under new liberal reforms, well, good news. Thanks to the National Insurance Act of 1911, you will now be provided with some money if you're too sick to work. Yay! In the past, you'd have got nothing and probably would have starved or been evicted from your house. But we'll look after you. Hooray! The only thing is you will have to put in a contribution, so it will cost you some money. But what if I can't afford it? Well, no one said the system was perfect, but it's certainly a lot better than it was in 1800. Don't you agree, New Liberalism Bear?
Woo! Yay! We've introduced some reforms that are definitely going to help people. They are definitely a step in the right direction for public health. Woohoo! Woo!